I wanted to talk about the story of Brooke. Brooke's story has been on TV multiple times. She started at the age of 18 with rheumatoid arthritis, which hospitalized her in acute pain. She developed pain in multiple joints of her body and was given correct treatment, which included pain medication, muscle relaxants, and treatment for rheumatoid arthritis. Rheumatoid arthritis is an active inflammatory disease of an autoimmune nature, which develops as your own immune system attacks your own joints. As a result, when the disease is active, it eats away the joints. Brooke went for the next 10 years without her rheumatoid arthritis being in remission. During that time, she had hot, swollen, tender joints that were red, and the joint spaces and the surrounding bones were literally eaten away. They looked like rats had eaten them. Originally, Brooke started taking pain medication and muscle relaxants. The unremitting pain continued to escalate, and she took more and more drugs and more tranquilizers to knock herself out. She became unable to sleep and unable to move and was uncomfortable. She needed a large amount of drugs and muscle relaxants to move around and tranquilization to sleep. Over the years, she was treated at many universities and by multiple doctors. Her drug dependency escalated, and she started passing out, overdosing on drugs, and needing more and more. The end result was a combination of pain and addiction. She saw multiple pain doctors, multiple rheumatologists, was tried on multiple new medications that work for rheumatoid arthritis. None of them worked for her. She was on cortisone preparation for years and had persistent problems. In the end, Brooke was suffering, taking pills, passing out, and her disease progressed, resulting in a crippling disease. During that time, she was put in treatment twice for chemical dependency. Removing the pain medications suddenly, in fact, makes the rheumatoid arthritis worse. It has an immune suppressant effect. The narcotics in themselves are immunosuppressive. We don't know why, but some people have escalating problems, and the side effects of the drugs make the disease worse. Brooke feared going into chemical dependency treatment centers where they took her off drugs, left her screaming, and left her disease, in fact, worse. Ultimately, as any who has seen the show Intervention notes, that I went to town, helped with the intervention, and brought Brooke to Bay Recovery for treatment for her pain, rheumatoid arthritis, and chemical dependency. The initial period of treatment was to stabilize her drugs and to stabilize her opiate treatment. She was placed on a drug called Suboxone, which stabilized her immune system. Other treatments for rheumatoid arthritis were used. And after 10 years of active, crippling arthritis that was actively eating away her joints, her underlying disorder of rheumatoid arthritis was put into remission. The end result was that the original problem of rheumatoid arthritis was in remission, but her joints had been eaten away. She had severe problems with her ankles, hips, shoulders, and knees. The first phase of treatment was to stabilize her rheumatoid arthritis, and Brooke remained in treatment at Bay Recovery for several months. In addition, it took several months to stabilize her condition, and multiple medications were needed to assist in her chronic, real pain, as well as the multiple surrounding problems that included sleep disorder, anxiety, depression. The first phase of treatment was to stabilize these.